Closed captioning for Lakeland Currents is supported by the Minnesota Department of Commerce, Telecommunications Access Minnesota, and Nisswa Tax Service. Nisswa Tax Service, tax preparation for businesses and individuals. Across from City Hall in Nisswa and online at nisswatax.com.
America has a new epidemic. Well, it's probably not brand new, but it's been emerging over the last X number of years. And the data from 2007 says that diabetes is now one of our huge problems in this country. In 2007, it was estimated that 24 million people had diabetes, and another 6 million people had it and didn't even know. So now we've advanced 3 more years past 2007. We're in 2010, and we don't exactly know the statistics exactly, but we know that that is increasing, and hence we call this an epidemic. So our program tonight is about diabetes prevention and how to cope with it if you have it. And my guests are from the Essentia hospital system or healthcare system here in Brainerd. I don't know if I said that right, but it's Essentia anyway. To my immediate right is Michelle Pelkey, who is a registered dietitian and a certified diabetes educator. And to her right is Danette Holznagel, who is a registered nurse, a certified diabetes educator, and coordinator for the Diabetes Resource Program for the Essentia Health St. Joseph Medical Clinic. And to her right is Barb Brisness, who is board certified Advanced Diabetic Management Clinic Nurse Specialist. Those are long terms, aren't they? But we got through them all.
Clinical nurse specialist.
Clinical nurse specialist. What is it? Do you have a department at the hospital? Tell us a little bit about what you do.
Okay. Yeah. Thank you for having us. We have a department here, and we primarily make up that department. Michelle and I are educators, so we partner with most of the clinic appointments, and we teach classes. So we teach classes for type 2 diabetes. We see patients individually with type 1 gestational diabetes, and also pre-diabetes now. We've just launched an educational program for people who are at risk for developing diabetes.
Is it fair to say that there's a lot of people out there that probably have diabetes, or at least the early stages of it, and they don't even know it yet?
Absolutely.
There are many. In fact, it's estimated that even yet, at least a quarter of those that do have diabetes don't know it.
Wow.
And although we're catching more people early on, and even in the pre-diabetes stages, the early symptoms of diabetes are very general and not something that a lot of people would recognize, especially if they don't see their doctor regularly.
So this is kind of a recent movement, isn't it, in times that you're starting to get into prevention. I mean, what you would do, it sounds to me, is like try to prevent these problems before they actually hit people. Mm-hmm. How hard is it to get out to the people that you need to talk to? Is that a challenge?
It's a challenge because prevention care is not covered very well by insurance companies and Medicare. That's changing gradually, and I think as we come into 2012, we're going to see that changing with Medicare, which is very encouraging. But for the most part, the prevention of diabetes is not completely covered by insurance. So the education programs that are offered are out of pocket for a lot of people, which is a hindrance. It's a barrier for a lot of patients to consider taking education because they just can't afford it.
So when you do a lot of your preventive work or the exposing people to what this is there a charge for a lot of these courses then?
Yes.
Mm-hmm. Our classes and our individual sessions for people with diabetes generally are covered by their insurance plans, and including Medicare and that sort of thing. But yes, there is a charge for them. But they do get a really good value. Our classes, our type 2 diabetes classes, are 10 hours of education, which is pretty rare in terms of diseases that people can get that amount of education too.
What is diabetes? Can you help us understand what it is?
Maybe we'll defer to Barb here on that one.
Well, diabetes is really a problem with our body burning its main source of fuel, which is sugar. Sugar is our energy. It's our primary source of fuel or gasoline that our body functions on every day. And if you have diabetes, your body, your muscle cells and tissue cells are not actually using that fuel for energy. And so that fuel is just staying in your blood. eventually that your kidneys flush that sugar out your urine, and basically your energy goes right down the sewer. And people, number one symptom of type 2 diabetes is fatigue. And so it's really a problem with your body burning its primary source of fuel, which is sugar, and ultimately results in problems with blood vessels and nerves.
In what sense? They deteriorate? Or they...
Over long term, having elevated blood glucoses or blood sugars, patients or people experience problems with blood vessel disease and nerve disease. Ends up resulting in blockages, and this doesn't happen in a short period of time. It doesn't happen in weeks or months. It happens over many years. When we're talking about the diagnosis of diabetes, one of the problems is people can have type 2 diabetes for many years without knowing it. And it had been estimated a while back that it was actually 7 years between onset and diagnosis. So many times patients have been diagnosed with some complications even prior to knowing they had diabetes.
And how many types of diabetes are there?
That's a good question. Well, there's type 1 diabetes, which is essentially the body cannot make insulin any longer. The beta cells, which are the cells in the pancreas that make insulin, are no longer functioning. And then type 2 diabetes is more of a gradual process where there's a relative inability to make insulin, but primarily it's resistance to the insulin that the body's making.
So the type 1 is the most severe?
Not necessarily. Not necessarily.
Really?
The problem is that people tend to think of it that way because in type 1, the body isn't producing any insulin, as Danette was saying. Either way, it can result in the same sort of damage to the body, though, if it's not kept in control. So with type 2 diabetes, even though a person may be making enough insulin, if their body can't use it effectively, it causes, in the end, the same types of problems. And in type 2 diabetes, as Barb was saying, that's where we especially see that long-term effect on the blood vessels, affecting the risk for heart disease, stroke, nerve damage, and other related problems like that.
I think we tend to think of type 1 diabetes too as being more severe in the fact that people will require insulin if they have type 1 diabetes because they do not make insulin. And with type 2 diabetes, oftentimes it can be treated with lifestyle, healthy eating, exercise, oral medicines. And people tend to find that to fit into their lifestyle easier.
Type 2 diabetes is the most common.
Yes. About 90% or 95% of people.
And how much
with
of this
diabetes.
is hereditary?
Very hereditary for type
Really?
2 diabetes.
Well, and in fact, type 1 diabetes has some hereditary links as well, but type 2 is highly hereditary if you have, even one parent with diabetes or a relative. And they're finding in research that there are more and more different genes that are involved in determining someone's risk for developing type 2 diabetes. And of course, our modern lifestyles really contribute to the likelihood that will play out and people will develop diabetes, which is one of the reasons that we think we've seen such a huge increase in type 2 as well.
And when you say our lifestyles, what do you mean specifically?
Well, one of the big risk factors along with heredity for type 2 diabetes, for example, is overweight and obesity. And in our country, 2/3 of the population is overweight. So that right there is a risk factor.
That's an incredible statistic,
yeah.
isn't it?
Yeah.
Yeah.
Obviously, you all practice what you preach, but 2/3 of the population is
2/3,
overweight.
yeah.
Wow.
And, some of the other things are the lack of physical activity. When we look historically at the levels of physical activity that people got just to heat their homes, for instance, it was a lot greater than it is now. I mean, many of us have desk jobs and all that sort of thing. The type of food that we eat, lots more processed food, fast food, fatty foods that even independent of diabetes increase disease risk, but in combination with diabetes do so even more.
What does it mean to be pre-diabetic?
It means that you are now at risk for developing diabetes. And it's estimated that window of time could be up to 10 years. So,
Really?
yep, and that window of time is affected by what other health factors might be a part of that person's lifestyle or health history. So if they have a health history of heart disease, that window of 10 years might be shortened. But prediabetes is a blood sugar that is greater than 100. So normal blood sugar for someone with no diabetes would be 70 or 70 to 100. Up past 100 would then be diagnosed as prediabetes. Type 2 diabetes would be a blood sugar of 126 and higher. So there's this window of time when there is, the body is still able to maintain a normal blood sugar or relatively normal, just above normal, but they're at risk for moving toward type 2 diabetes.
And it may be also the presence of insulin resistance. The body may be able to make more insulin to meet the body's needs, but there are some metabolic problems happening when they're diagnosed with prediabetes.
So this isn't obviously always people who are obese. I mean, that obviously raises the incidence, but a lot of people might be very normal looking, like our camera operators, and still be at risk.
Could be. It's more common to see obesity or overweight as part of it because that automatically will increase resistance.
For type 2.
For type 2, not type 1. But in prediabetes, moving toward, I think that was your question, moving toward type 2 diabetes, weight is, and that's why I think we're seeing such prevalence in children now. You know, there is a huge problem of obesity with children now.
And when you say children, are you talking about like 6 and under, or are you talking elementary school level?
All of the above. You know,
Really?
we're starting to see young children who are quite overweight and obese, and now there are, where we used to consider children only to develop type 1 diabetes, we're seeing type 2 diabetes in children now.
Wow. And is most of that related to weight?
Primarily, yeah, lifestyle and weight. Inactivity, children are less active than they were maybe 10 years ago, and their weights are higher.
I think it really stresses the importance of our kids really, you know, getting outside and playing, riding bike, playing ball, and limiting that TV time and that computer time, those sedentary types of activities that our kids really enjoy today.
So if you have a patient walk in and they've been identified as pre-diabetic, what typically would you start doing with that person?
The recommendations for prediabetes are primarily to watch fat and increase physical activity and lose weight. That's the primary method for prevention with prediabetes.
And really, that came about because of some major studies, research studies that were done, including with the cooperation of the International Diabetes Center in Minneapolis. And there was a several-year study called the Diabetes Prevention Program, where they really were looking at, is this going to make a difference to prevent diabetes? And they actually found that they had 3 arms, I believe. One where there was just very basic intervention, one with a medication called metformin, one that was primarily focused on diet and exercise, the weight loss and the increased activity. And in fact, the diet and exercise portion, the weight loss and activity, was twice as powerful even as the metformin, the medication, decreased the risk of developing diabetes over the term of the study, which was, I believe, 9 years, by 58%. So it's a huge, powerful, you know, intervention just by things that we can do on our own.
And that consisted of 150 minutes of physical activity once a week, like 30 minutes a day, 5 days a week, and 5 to 10% weight loss.
Do you find that most of the patients you work with take it seriously and make an effort, or is it like smoking and some of the other bad habits people have? They hear about it and they become educated, but it's hard to change the habit.
You know, it's a challenge just as any chronic disease, because a chronic disease means that this is a part of your life for the rest of your life. You're never going to do it perfectly. You know, a chronic disease means you are managing this day to day with all of the other stressors that you have in your life, which is really challenging for people. So we try to encourage people that, you know, we're going to help equip you to have the knowledge and the tools to be able to move forward and manage this disease. Maybe this disease combined with also heart disease or lung disease or obesity or problems with your cholesterol. Maybe they're managing several things, which can be very challenging and be very discouraging.
When we think of it too as, it's basically healthy living. It's encouraging people to find some activities that they enjoy that are physically active and to do them every day, and to eat healthy foods, to include vegetables every day and whole grains. And
I think most people really are, especially when they're newly diagnosed, they're very motivated to make changes. As Danette was saying, the challenge is really maintaining that over time. I think that one of the biggest, probably, I don't know if I would call it a myth, but mistaken assumptions about dealing with any type of diabetes is that people have to give up eating all kinds of things. And it really, what we recommend for people is really the same kind of healthy eating that's good for most everyone.
Pizza, sausages.
Veggie pizza. It's whole grain foods, it's low in saturated fats, it's lots of fruits and vegetables, it's lean meats, it's that sort of thing that's, by and large good for most people. And that's really the whole foundation. And, if we can get that message out to people, I think that's really important, because it really is a lot less nowadays about giving up all kinds of things. It's about knowing how to manage with the right kinds of foods that are good for everyone.
The American Diabetes Association estimated as we started the program that there's about 24 million people. Most of those are type 2 diabetes, I believe. What is it looking like in Minnesota? We always pride ourselves for being such a healthy state. Are the trends the same here, or what are we seeing?
Minnesota really parallels the rest of the country. We have a huge problem right here in Minnesota.
maybe not quite as severe as some of the states down south, but
Numbers are a little
certainly
higher
we're
there.
right behind them.
And it depends on ethnicity too. Ethnicity plays a definite role. Certain ethnic groups, Native Americans, African Americans, tend to have a higher risk for type 2 diabetes. And of course that varies on all the same factors too, but that plays a big role as well in some cases.
We're talking about the increase in healthcare costs. They're driving up for all of us. It doesn't matter if you work in a hospital or not. We're all paying the same cost increases. What kind of impacts is this disease having on people and on costs?
This is having a huge impact. We see it every day with patients having difficulty filling their prescriptions or having to choose maybe what would be a second choice for a medication or treatment plan simply because the first choice is too costly. And so we see it every day where we're trying to work with patients, especially those people on Medicare who are working in this what's called the donut hole, and they get to this point where they just literally cannot afford the medications. It's a great problem.
What is the donut hole? What does that mean? Can you help me with that?
I'll just summarize it.
Well, there's that certain level of, if they have a drug plan, there's a certain level up to which they have coverage, and then they have a gap in coverage until they reach the next level. So within that gap, they have to pay all their own costs. And the real challenge is that people with type 2, for example, people with type 1 always take insulin. They have to take insulin to survive. So depending on how much they need, obviously there's a lot of cost with that. With type 2, one of the challenges is that it changes over time and people don't stay on the same regimen. Many people with type 2 diabetes are on 2 or 3 medicines to control their blood sugar, 2 or 3 medicines to control their cholesterol, and 2 or 3 medicines to control their blood pressure, in addition to anything for other health conditions that they might have unrelated to diabetes. So, and that might change over time, the amount and the type of medication. So it's quite a burden on them.
I think we always need to think too about the cost to society if the disease goes untreated, because that's where we see some of the larger healthcare costs as far as end-stage renal disease, looking at patients requiring dialysis and just major complications down the road that will be a large cost to society.
But are preventable with good care to a large degree.
And I think with our new healthcare reform, we're really going to be looking at how can we prevent some of these things, because the bottom line, it's going to save healthcare dollars. to treat them early, prevent them if we can, but certainly prevent complications.
For instance, 95% of patients who are diagnosed with diabetes in Minnesota are estimated to have chronic kidney disease. So
Wow,
that is
95%.
that's a huge, yeah, at different levels. There are various levels of degrees of chronic kidney disease, but certainly that's a long-term impact for their health, a long-term impact for their finances.
So are you talking dialysis for a lot of these folks?
Potentially, if it were to progress to that point.
Wow.
But again, many of those complications can be delayed or prevented with good care and intervention, and that's why it's a challenge for people to balance what they need to take care of it versus things like the cost.
You've talked a little bit about this, but maybe you could talk a little bit more about what are the risk factors for this type 2 diabetes?
And we kind of hit on that: family history, ethnicity, obesity.
Increasing age, as we get older, we're more at risk, and certainly people are living longer. That is probably also contributes to the increased incidence of diabetes. But.
And oddly, some of the risk factors people are really not aware of is that someone who has had trouble earlier in their life with getting low blood sugars can actually be at higher risk of developing diabetes later, because we think there's a problem with how the pancreas is working, which is what makes the insulin. People who have high blood pressure earlier in life are at more risk for developing
And what would
diabetes.
you define as earlier there?
Well, at any point in their life, maybe they developed high blood pressure in their, 30s, but they don't develop diabetes until they're in their 50s, for example. But we know that the presence of that high blood pressure in that person is a risk factor for developing type 2 diabetes.
You can see where people don't have the financial means to buy this medicine, they're in trouble, aren't they? I mean, they really are. You can look at
And that's why prevention is so important, and it's really encouraging. I think that's the message we want to give people is, it sounds bleak. It doesn't have to be bleak. It can be very encouraging. There's much to do for prevention.
And I think many of our patients have said, once I learned about this and I changed the way I'm eating and I'm more active, and they say, they come back and they're like, I feel better. I haven't felt this good for a long time, and I know I can control this, and I have control over, my long-term
I mean,
health.
I think all of us could attest to the fact that I can't even tell you how many patients that we've worked with who, once they have their disease in good control, they're managing their blood sugars and all those different aspects of it, really tell us, I feel better than I've felt in years. Just doing
and
those
overall,
healthy
I think, people want to live healthy. I mean, everybody wants to be healthy. It's just there are many barriers, and we were talking about change. Change is difficult, and I think people really need to look at, what's just one change that they can make. If they only make one change, if they try to incorporate, some vegetables into their diet every day. Or looking at I'm just going to start walking 15 minutes a day, or I'm going to park further away from
we
work
try to be
and
very
walk in.
creative with our patients. Sometimes if they can't get out of the house and walk, for example, this is bad weather for walking right now with ice and snow, we tell them, set a timer in the house. Walk around the house for 10 minutes and just move. If you don't, we aim for 30 minutes. If you can't get that, if you can get 10 or 15, that's better than
Every
nothing.
little bit helps.
Every little bit helps.
There's really nothing you can do to prevent type 1 diabetes, is it? I mean, if you get it, you got it.
Correct.
And what are some things that you could do to prevent type 2? You said weight reduction. What are there some other things?
Exercise, weight reduction, eating a healthful diet, and again, as Michelle said, what's recommended for a diet for diabetes is what would be recommended for any of us. So it isn't a complicated diet. It's relatively easy to follow.
When people get to the point where they're losing toes, feet, are those type 1? Or
It could be either.
It could be 1 or 2, and they've just progressed to the point where there's damage. I mean, there's just damage.
Correct.
Long-term high blood sugars is the main risk factor in high blood pressure, but that doesn't occur over a short period of time. It happens over many years, maybe 10 or more years of high blood sugars.
Wow.
And I think that one of the other messages we would really like to convey to people is that, don't be afraid to come in if your blood sugars are high, because oftentimes we've seen people avoid going in to see their healthcare provider because they keep saying, if I would just do things right. But because diabetes can change over time, it may be that they are doing things right and they need a change in their treatment regimen.
And nobody can do everything perfect, and I think we can't expect that. And I think if they're doing the best that they can do, then they need to go in and say, I'm doing the best that I can do. I'm not eating perfect, and I'm not exercising every day, but I am trying, and I'm doing the best I can do.
So it sounds like you really are a support system as much as you are helping them figure out ways to prevent this disease.
And there are resources also for people if they don't have coverage to meet with an educator, or there's resources online, diabetes.org. The Diabetes Association has some very good resources on preventing diabetes and treating and just dealing with the emotional aspects of diabetes. And
could you just give that website again?
it's diabetes, just www.diabetes.org.
And that gives a lot of kind of information about prevention and...
That's the American Diabetes Association website, so it's very comprehensive.
And how do people get in touch with your departments if they're from central Minnesota?
Well, we're actually listed as providers on the American Diabetes Association. We're a recognized program. They have a list on that website of all recognized programs, and so you can go onto that link and you can identify a recognized program that has diabetes education and training and management. And so there would be one place to start, but
They can also call. Essentia Health St. Joe's website is also another place that they can find the information on the program and phone numbers.
Talking to their physician too about getting in touch with an educator. Most insurance companies do require a referral from your physician, so seeing your primary care provider and asking to see the...
It's good stuff. You're doing good work. Thank you for coming.
I just heard this quote, and I just want to say, this is the first time in human history that we've had to run away from food and pay to exercise.
Wow.
And I think that's really the bottom line.
Well, thank you for coming on the program. We appreciate it, and hopefully we can help somebody that maybe has this problem and help them identify it. You've been watching Lakeland Currents, where we're talking about what you're talking about. I'm Ray Gildow. So long until next time.